give it to me. Different kind of clamps. We also have this one too. We have a different kind of clamps. They divided into straight and curved. For example, they could be curved in different way. In this way, the first variant, and in this way. See, yeah? So, straight and curved. They have their own name. In USA, they have their own name. In Russian, absolutely another. If you want, I can bring the name in English and in Russian, because in exam, professor can ask you Russian names. But yes, but in general, in the USA and in Great Britain, they have their own name. They have different shapes. What I mean. So, for example, this one. This one we call coher. They have the length of the branches are big. Between them, and the smallest one we called mosquito. Mosquito. Clamp mosquito. Coher clamp. And this one called bilrod. Bilrod. Straight bilrod. And the second variant, curved bilrod. So, once again, coher, bilrod, and mosquito. Mosquito we use for small vessel, yeah, mosquito, different kind of mosquitoes. Okay. Thank you very much. Coher and the bilrod. With help of this instrument, we can clamp tissues. For example, muscle. We can take aponeurosis, fascias. So this is for tissues, for big tissues, yeah. And for huge vessel that we don't need anymore because we damaged the vessel between branches. What else? What other difference between these clamps? Look, here we have a structure that we called red tooth. Yeah, this is the surgical variant. Yeah, this is the real coher. So, and here it's absolutely plain. Yeah, it's traumatical variant. It's non-traumatical variants. So, you need to remember, instruments with the red tooth are always called coher. So we have also forceps that's also called coher because he also have a red tooth. So, different kind of clamps we use to stop bleeding in the wound. What are the variants we can stop bleeding? For example, we have a muscle, yeah, and we have a bleeding in the wound, and you don't understand where is the vessel. Maybe it's so small, maybe it's located really deep, somewhere between the tissue. You can put into the clamp the whole muscle and put a suture. And this way you stop bleeding. Sometimes we do it. You do it when you can't find the vessel. If you see it, exactly you will take only a vessel. But if you don't, if you need to stop bleeding, you can put a clamp into the whole tissue. Okay. So, clamps and auxiliary instrument. Yeah. For example, we start with forceps. We have different types of forceps. For example, ophthalmological forceps, they are really thin. Yeah, gynecological forceps, they are long. Yeah, the length of these forceps. Yeah, special forceps with look like a forks. Yeah, it's forceps to take a piece of bone when we have bone damages. to take a stone from some structure. For example, you find stones into the gallbladder, you remove it, use this instrument. It's also comfortable to use muscles with this kind of forceps, yeah, because of this surface look like a spoon. In general surgery, you always find these two forceps. One of them called anatomical, the other called surgical. Anatomical, non-traumatical forceps. It's plain, there are no any tooth. This one has a tooth. With this instrument you can take all structure. So you can take a vessel, you can take a muscle, parenchymatous organ, what else? Fatty tissue. With this instrument, it's usually used for epinephrosis and fascias because we can traumate this tissue, and for making a suture on a skin because it's really not comfortable to take a skin with this anatomical instrument, anatomical forceps. Anatomical, surgical. Remember? Once again, I'm a nurse, you're a surgeon. Really not good. So, this is the right position of the instrument here. So, here. Not this way, not this way, not this way. It's not a scalpel. It's a forceps. Yeah, somewhere here. So, look at this wider part, yeah? So, if you press here, the tip will connect together, yeah? So, this is the main idea. So, and I can take any structure, whatever you want. Yeah, a little bit upper. Yeah, in the middle, in the wider part of the forceps, you need to put your finger. Two better this way. Okay, this is a non-working position here. Working position. Working position. Okay, different retractors. It's also auxiliary instrument. We have plain retractors, plain hooks, we call them hooks, yeah, it looks like a hook. In general, it's a retractor, different kind of retractor. Plain retractor, tooth retractor with 2 teeth, with 4 teeth. The position of the retractor in your hand. Imagine that this is the one. You are a surgeon, I'm an assistant. I need you to help you, yeah, to open the wound. You are right-handed or left-handed? Right-handed. So your working hand is here. You have some special instruments, scalpel or something else, and I need to help her. If I put this way, he cut my hands. Yeah. So I will do it this way. Yeah. If you have a plain retractor, your palm should be here under the hook and here. So this stop your fingers here, yeah, and from this side this way. So this is the right position of the plain hooks in your hands. This is the right position of the hand if I'm an assistant and she's a surgeon. If you are a left-handed, it will be more comfortable to do it this way. I'm like an assistant. My main idea, yeah, my main goal. Hello, just a moment. The main goal is to help my surgeon. Yes. So if we have these hooks, if we use it, you need to take it this way. Sometimes this way. It's special for your fingers. Do it this way. Yeah, retract with and same. If she's a surgeon and I'm an assistant. This hand, I will take it in this way, here, this way, hooks. Okay, what else? Probes. Probes, this is a special instrument to make a revision. The first idea, we have different kind of probes, but here only one. Okay, these special probes for making an incision on a fascia. Imagine the situation. Where is the scalpel? Here. You cut a skin, under skin fatty tissue, find a fascia, find some epinephrosis, yeah? You take a forceps, hold the epinephrosis between two forceps, this way. I do it like assistant. My surgeon take a scalpel and make a small punction. After that, in this small punction incision, she put a probe because under the fascia could located neurovascular bundle, yeah? And this instrument protects them from my sharp instrument. It could be a scissor, it could be a knife, yeah? It could be a scalpel. I put it under the fascia. Help me. Yeah, and make an incision. Use this instrument this way. So, this is the probe. What else? Syringers, yeah? Different kind of, it's not right. It's a special punction needle for bump punction. So, this instrument, special instrument, yeah, if we talk about the wound, we use for local anesthesia, yeah? Kind of anesthesia we will discuss later. What else? What other special auxiliary instrument? Different towel forceps. This towel forceps will help us to cover the wound, yeah? When you prepare the operating pool, yeah, you have special towel. Imagine that here we have a wound. You need to cover your wound with special towel, yeah, to protect all other part of the skin from incisions on the one hand, to protect my wound from different microbes from other regions, yeah? And to connect these towels, I use this towel forceps. This way. This way. Okay. What else? Yeah. This is the sponge, the tampon forceps.
Cotton.
Yes, we call them korch, or we'll say karntsang in Russian, yeah? Because professor always ask about it. With this instrument, the position in your hand is the same one, yeah? So, this way, you can make a tampon. Tampon you use for sometimes to stop bleeding, to clean the wound, for example, yeah, to clean the skin before you make an incision. This is a tampon. So, this is a korntank, or in English, I found the translation that this is tampon forceps. That's all, tampon forceps. So, professor will ask, find me or show me a tampon with a corn tank. Use a corn tank, use a gauze, and make a tampon. We have another kind of, give me a clamps, please. No, all of them. All of them. Mhm. Where is it? A grouse with the coher this way, called toothframe. This instrument, this construction, we use to remove the blood inside the wound. Yes, somewhere, to make a revision. Is there any liquid or blood in my wound? I can't see it because it's deep. Yeah, so it's for surface. Yeah, for cleaning the skin. Yeah, to take a wet, yeah, from the forehead of the surgeon sometimes. And this is for wound for walking inside. Yeah, this is a tupfer. This is a tampon. Tupfer, tampon. Okay. So, I suppose that's all. We haven't got time. Next lesson, you will prepare me the next question. Yeah, we will start discuss anatomy of forehead. Yes, so not forehead but forearm. Yeah. So the questions are on a website. The translation are really not good, but if you have some question, I will try to answer for them. So, and all this information you need to prepare too. We didn't discuss a surgical nose. It's also interesting, but next time bring, please, I don't know how to say it in English, but a thread that we put here, what is it?
Shoelace.
Laces, yes. Put different colors laces. So, for example, red one and a green one. And we will try to put a surgical nose. Nose, it's also a question for exam, for the practical part of exam. So, next lesson. Second question, yes, second lesson, prepare. I will ask you. Maybe you will have a test control, maybe, I'm not sure. Instrument. What else? Notes, yeah, don't forget your hats, gloves, and mask. Okay, see you in a week.